Do you have Medicare, and did you miss the annual election period last year? And could you use some help with your secondary supplemental Medicare insurance? Hi, I'm Tommy at MedicalInsuranceToday.com. So this will be a longer form video for what we call election periods. So most consumers are not aware of these logistics agents have to work within. Most consumers believe, hey, I have this insurance policy, I want to change it. Let's call an agent and move my policy. We get those calls often. I'm here to inform you that there are some very significant constraints on when Medicare recipients can change their plan, and I want to give you a little bit of insight on what those options are and what can be done. So historically and generally, most Medicare consumers are aware that October 15th to December 7th is the time of year that most folks can change their plan. That's called the Annual Election Period, or AEP. So that's kind of the no questions asked window of time that you say, I want to move from this plan to that plan, this plan to that plan, etc., that you can move around, and then your new coverage starts at the beginning part of the year, January 1. A lot of folks, because it overlaps with the holidays, they're not looking at annual notice of change documents, or very lengthy and boring documents that show, what your copay is going to change to, what your prescription coverage is going to change to for that next year upcoming. Now, what started happening literally after December 7th, on December 8th, our phones started ringing like crazy. People went, I missed my window, I need help. So we've been, thank the good Lord, very productive through the holidays, and especially very busy since the first part of the year, since we've been back after the new year, with folks needing to change their secondary supplemental, and we know the ins and outs of how to do that. So if you're running into issues, we can help you. Number one to talk about is what's called the OEP, the Open Enrollment Period. This is specific to Medicare Advantage. So if you are on a Medicare Advantage and you're unhappy with the changes that happen, unhappy with the company, unhappy with the doctors, whatever changes might have happened, you have this one-time window to change your Medicare Advantage plan in the months of January, February, or March to another Medicare Advantage plan for the year 2026. If you're going to do that, make that change, do it early, because you have copays and things that are starting to accumulate if you're going to the doctor, etc. So the OEP usually keeps us really busy in January, February, not so much in March. But we've already helped a number of people that said, I didn't know this change was happening and I want to move from this company to that company. And we've been, those last couple of weeks, really busy. Now, that's for specific Medicare Advantage, the OEP, and that ends in March. There are two other windows for folks that really apply this time of year if you're unhappy with your plan. The first is if you're on a Medigap Supplemental, traditional supplement for Medicare, where you're paying a premium, unlike Medicare Advantage, where you're paying that premium for the supplemental. It's not always easy to change during that window with the med subs, because Medigap Supplemental is an underwritten product when you're switching. So they're going to look at, these insurance companies are going to look at someone's health to change their policy. The problem with this is one window where folks, if they are on a specific plan and they're unhappy, if they have health conditions, you can be declined to make that change on Medigap supplements. So if you have cancer, need surgery, or any lengthy list of major issues, it's not just the little stuff. We're not talking blood pressure and cholesterol and thyroid issues and, regular daily maintenance medication type issues. We're talking about really significant health concerns, which many seniors have. There is a window, though, to change that. So if you have those health issues, you have a guaranteed acceptance window around your birthday to change your Medigap supplemental. So let's say you have, God forbid, cancer, or you have some significant disease that would prevent you from getting approved on a Medigap supplemental. During the 60 days prior to your birthday month, and then thereafter, depending upon the company, you have another window after the month of your birthday. So it generally gives you a 90 to 120 day window around the month of your birthday to switch your Medigap supplement, and that is a guaranteed change. They cannot decline you regardless of your health. They cannot say no. And I have a bunch of people lined up for this year that are trying to change their Medigap supplement because they're on X plan and it's gotten too expensive and they want to move to an alternative plan. So around their birthday month is when you can make that change for your Medigap supplemental. So we touched on OEP for Medicare Advantage, talked about birthday month for Medigap supplemental. The third one is these FEMA declaration and disaster declarations. So FEMA, Federal Emergency Management, they declare emergencies based on storms and fires and things. We're in California, so we experience a great deal of that. There are windows of opportunity to change based around a FEMA declaration with these insurance companies. So again, this is insurance company talk, insurance agent talk that really doesn't concern most consumers. When we talk to most consumers, they say, I want to change my plan, and they have no idea that there's constraints to changing oftentimes. So that's where an experienced, licensed agency and agent group can help you. Something like our company here, Medical Insurance Today. We know the ins and outs of how to change these plans, these election periods as they're called. So if you're in a Medicare plan that you're not happy with, if you have concerns about your 2026 plan, price has gotten too expensive, copays or coverage has changed, and you're not satisfied, please reach out to us. We can help you, or at least line out if and when you would be able to change your plan. Please reach out to us, medicalinsurancetoday.com, and we look forward to serving you.